Forward. Okay. So my talk is about the highlights of Mount Sinai Heart Cath Lab through the years, currently, and possibly our future goals. A short history of the past reminds us that during the 1960s, the advent of the heart-lung machine ushered in the era of modern cardiac surgery. Bypass graft surgery was the most common operation performed by cardiac surgeons. In 1970s, anybody who goes for cardiac cath, whether it's going to be a one-vessel CAD or two-vessel, they definitely go for a bypass. And then in 1977, the first balloon angioplasty procedure in a coronary artery, as mentioned by Antoinette this morning, was performed in Zurich, Switzerland. Mount Sinai Cath Lab, during that year, we only had 2 procedural rooms, 1 adult cath and 1 EP being shared with pediatrics. We have 6 to 8 nurses, and we do like 10 to 12 cases a day, averaging. The first intracoronary stent, which are the bare metal stents, were successfully deployed in 1986. In 1988, Cath Lab has increased their rooms from 2 to 3. Now, nurse-wise, we have like 8 to 12, but now we're doing more volume, which is like 20 to 25. Dr. John Ambrose was the director back then. The drug-eluting stent era was around 2002, 2003. We started with Cypher, then a month after, we went for Taxus. In 1996, Dr. Samin Sharma became the director of Mount Sinai Cath Lab, and in 1998 was the first annual complex coronary case symposium to go together with this nurse tech symposium. Led by Dr. Sharma and Dr. Kinney, the Mount Sinai Hospital Cath Lab is the nation's best and busiest. Comprised of some of the world's most experienced cardiologists, our Cath Lab offers expert diagnosis, state-of-the-art technology, and unparalleled excellence, interventional cardiology care, and patient safety. The mission of the Cath Lab is to improve outcomes and safety of interventional patients by delivering clinical innovations, unrivaled research, and personalized clinical care as a team concept. The vision, to be the #1, highest in volume, and lowest in complication in the entire nation and the state. In 2008, we have doubled our volume. In 2003, we were making like 2,500, and then in 5 years' time, it ballooned to 5,000. It was a big year for all of us. Our Cath Lab has achieved the highest safety rating among New York State's 61 institutions that perform PCI and is internationally recognized for expertise in the full spectrum of techniques for complex cases. Mount Sinai Cath Lab started broadcasting live cases in July 2009. This is to build a community of interventionalists exploring cutting-edge techniques in catheterization. Our Cath Lab is internationally recognized for a vast expertise in the following complex procedures. In one of his interviews, Dr. Sharma said, and I quote, "We have a set protocol for all the routine and complex procedures. If a complication should occur, we have protocols for how the procedure should be done from a technical point of view." Other important highlights include Dr. Kinney. She was honored as the Physician of the Year in 2014. And just recently, she was a recipient of the prestigious Ellis Island Medal of Honor, the highest civilian award for immigrants in the United States. Of also note, Dr. Sharma was also awarded Physician of the Year in 2007, and he also got the award, Ellis Island Medal Award, in 2011. With her own words, I like this very much, Dr. Kinney said, "Patient care does not stop with the physician. It starts and begins with nurses. If it was not for nurse and nurse practitioners, our high performance in the Cath Lab doesn't matter. It is our daily work side by side that is bringing us one step closer to making Mount Sinai Heart the best heart hospital in New York and in the nation." One very important aspect of patient satisfaction is making the in-hospital stay as short as possible. With this in mind, approximately 60% of our elective interventional patients are safely discharged on the day of the procedure, following an established ambulatory discharge protocol. So why choose Mont Sinai Cath Lab? The Cath Lab at Mont Sinai Heart is among the highest volume, safest interventional cath lab in the United States. Consisting of 7 adult cath rooms, 3 equipped for endovascular procedures, the Cath Lab is established as the tertiary center for complex coronary valvular and vascular interventions. 2 of the rooms are hybrid Cath Lab, which are equipped to perform TAVR, or transcatheter aortic valve replacement. All cath rooms are equipped with intravascular ultrasounds and fractional flow reserve capabilities and other imaging modalities. As science continues to guide medical advancement, the design and functionality of Cath Lab and vascular suite will continue to evolve. The future Cath Lab will likely include design and technology features such as robotic catheter, manipulation directed by advanced imaging systems, advanced digital imaging, miniaturization of therapeutic devices, and a lab design that will minimize staff and patient radiation dose. Cath labs have come a long way, but what is next on the horizon? Will robot-assisted procedures in the Cath lab become a commonplace in a hospital setting? No one can predict for sure, but one thing is certain. The healthcare delivery of the future will require a willingness to think creatively and investigate out-of-the-box solutions. Care that provides value with a high quality at the lowest cost will require administrative and medical staff leadership, support, and collaboration in order to drive sustainable change. Thank you.